I do want to highlight the conference that Rebecca Shaw had organized. It was unbelievable when I received this email to come to a conference that a high schooler was organizing in New York City. It just blew my mind. I thought there was I just misread the email. I was confused. Looking at the list of people that were going to be there, she had Lee Hirsch, who had just done the movie Bully. I was like, there's no way this is really a high schooler. And sure enough, although she looks 27, she's actually 18. So really very impressive, and I'm thrilled that she and her peers are part of this. And as we were talking about organizing this panel, it was very critical that not only we have a youth perspective, but that we also have a practitioner perspective. And so we're thrilled to have an interdisciplinary team here today to represent the practitioner's perspective. All have been working in schools, frankly, since before I was born. So it's except for Dr. Dolan here. But it's really quite an honor to have such a rich history of colleagues that are going to provide a unique perspective on this particular issue. So much like we did with the youth, I'd like you all to take a few minutes and introduce yourselves. Their complete bios are in the handouts, and you can see the number of accolades and years of experience they have under their belt and their individual contributions to the field of bullying and other kinds of activities they've been engaging in around violence prevention and positive behavior support. But with that, we'll start off with Dr. Dolan.
Welcome, everybody. It's my pleasure to be here and representing my school district, Anne Arundel County Public Schools. Anne Arundel, for those of you who may not know, was the wife of Lord Baltimore, and that's the name of our school district, about 45 minutes from here in Annapolis, Maryland. We're a very large school system of 120 schools and 80,000 students. We have been focusing on school improvement with school climate and behavioral supports since 1998, when we first began implementation of PBIS, and have moved into more of a multi-tiered systems of support. And along the way, we found our way to Dr. Bradshaw, who has partnered with us, and we're very thrilled to be able to partner with us. We've learned a lot. And one of the projects we have participated in is the Safe and Supportive Schools Grant, which focuses on school climate, improving school climate, and evidence-based interventions, amongst those being Oveus bullying prevention. We have an interesting history with bullying prevention, and most recently the state has a policy regarding reporting incidents of bullying, and we have tracked those along with our discipline referrals for bullying, and there's a disconnect with incidents that have been reported versus those that have been resulting in some sort of disciplinary sanction. So I think we need to learn a lot more about this. And in the survey results that we've analyzed over the last few years with the Safe and Supportive School Grant, we've found, no surprise, a disconnect between what the youth are reporting and what our adults are reporting, how it's perceived, how it's identified, and what's done about it. And we also struggle with implementing a systemic bullying prevention initiative. So those are our struggles in Anne Arundel County. And I'll turn it over to my colleague, Will Myers, principal in one of our great high schools.
Well, thank you, Jenny, for that introduction. I am Will Myers, principal at South River High School. It's the largest high school in our county, in southern Anne Arundel County, about 2,250 students. I've been there 8 years, and during that 8 years, and in my experience at other high schools, has been that bullying has always been a problem. And as a leader of the school, you have to come up with the programs that would address those behaviors that are entitled bullying behaviors. And as Jenny's already alluded to, although our system has the typical rules and consequences for bullying behaviors, we don't have a systemic program for all our schools to follow. So each school individually does the research and looks what would work in their school. As a practitioner, hopefully today I can help give some of the how to implement what we've done with teamwork at the school to change the culture and to reduce the bullying behaviors. I got interested in this, well, a long time ago, but as part of the Maryland Safe and Supportive School Initiative, Got to attend some conferences across the country, talked to some really wonderful people, much like yourselves, even met Alveus himself and chatted with him about the program, and we feel that that research-based program has the best bang for the buck and can work. What I would comment about later perhaps is how to implement that in your school, because if you're familiar with the program, it requires a sustained effort over time to really implement and make that work. And you have to convince the people in your school that it's for them. So hopefully I can help with that today. I'm excited about being here, and I thank you for the opportunity.
Good morning. I'm Mike Donlin, and I'm from the other side of the country. Instead of Washington, I'm the other Washington. And so, for better or for worse, I am the school safety person for the state of Washington. So while I'm gone, I hope everything's good in the state. I would just like to repeat everything that both Jenny and Will have said. When I look at issues around bullying, I'm looking at it at a state level, taking it straight on down to the classroom level. I get calls from superintendents, from administrators, from teachers, and a lot from parents, and even some from students, so it runs up and down the scale. We have 295 school districts, about 2,300 individual buildings, and a state which requires a policy, a mandated policy on bullying prevention and procedures on prevention and intervention. Unfortunately, or fortunately, it's a local control state, so how that policy is implemented ranges across the state. As Will and Jenny were talking, a couple of things that came to my mind is one of the things we're trying to make sure that people understand. I think Jenny mentioned PBIS as a framework, Alveus as a program. We're trying to differentiate to let people understand that frameworks and programs and curricula and other student or teacher-made materials all fit together, that they are part of a whole, that it's a holistic system. And that bullying by itself doesn't exist. Bullying exists within the larger picture of everything else that happens in the school and the school community, which then is the other part of the factor that we talk about. Bullying is a community event, and it takes a community to deal with that event. So those are some things that we try to move out across the state and across our conversations in the state of Washington. One more thing, as a linguist, I'm a trained linguist as my background. Oddly enough, here I am in bullying prevention, and so the words that we use to me are very important in defining terms, understanding terms, making sure that people are using things correctly, so we're having a common conversation is also very important. And I really appreciate being here today with the Institute of Medicine. When I told people that I was coming for the Institute of Medicine, they said, for bullying? Yes, we're all working this together. So thank you very much.
I want to thank this great panel. You all have already triggered a lot of thoughts for me and things I know that are going to come up as we hear from the presentations over the next 2 days. And much like the youth charge, their perspective is going to be to listen and absorb. We kind of have this metaphor of a sponge in helping us think through what have they heard over these next 2 days, and what is the low-hanging fruit, what are the priorities, what are the big picture things that we need to focus on, and what are the gaps. So they're really going to help us map out a number of those different dimensions, so that way we can walk out of these meetings with some actionable steps, but also some longer-term goals. So with that, I want to thank the panelists and pass it back over to Dr. Riviere. So.
Thank you very much. So with that as kind of the background of where we are and who is going to be participating from their specific points of view, we'll get started with the main program. And our first speaker today is Susan Limber from the Clemson University, who's really going to provide us with an overview of bullying and victimization. Dr. Limber?